Have you ever wondered how a tiny mistake inside a microbiology lab can completely change a patient's diagnosis? Yes, in our field, even a small slip can create a big difference. Hello everyone, I'm Sneha, and today I'm going to take you through something every lab professional must know: the most common mistakes we unknowingly make in the microbiology lab. So let's begin, and trust me, some of the mistake might surprise you. The first and the initial type of mistake is improper sample collection. It includes collecting the swabs after antibiotics, using the wrong containers for collection of sample, and also not maintaining the aseptic conditions while collecting the sample. These can be avoided by ensuring proper timing before antibiotics, using sterile recommended containers for the sample collection, and also following aseptic technique during the collection. Incorrect labeling is the second type of mistake usually happens. It includes mislabeling the patient's name, missing the date and time of collection, and also doing wrong sample type. How to avoid this mistake? By triple check labels. The labels should be checked triple times. And using the barcode or clear handwriting while labeling the sample. Always note, label the container before collection and never after. The third type of mistake is delay in transport. The samples reaching the lab very late. The temperature of the samples while transporting is not maintained, and also the leakage of sample while transport. How to avoid these mistakes? Follow transport guidelines. Use transport mediums for swabs. And also maintain proper temperature, especially 2 to 8 degrees Celsius when required. The poor aseptic technique is one of the crucial type of mistake usually happens. It includes touching the plate surface, opening the lids too long, the cross-contamination from hands or gloves. These can be prevented by flaming the loop properly, opening the plates only partially, and changing the gloves between the processing of samples. The next type of mistake we are going to discuss is improper inoculation or streaking. It includes overloading the loop, not sterilizing the loop between the quadrants, and also the uneven streaking. How to avoid this mistake? Cool the loop after flaming. Flame the loop between quadrants, and also maintain control streaking patterns. Let's move to the mistake incorrect incubation. Wrong temperature, wrong atmospheric conditions, inverted position not followed while incubating the plates usually comes under incorrect incubation. This can be prevented by following specific temperature guidelines like 37 degrees Celsius, 25 degrees Celsius, using appropriate incubators, carbon dioxide, aerobic, anaerobic based on the sample, and also always incubate the plates in an inverted position. Let's discuss the mistake of misinterpreting the colony morphology. It commonly includes confusing the contaminants with pathogens, ignoring the mixed growth, not correlating the growth with clinical signs. The precautions to be taken are: observe the colony size, shape, and pigmentation. Always correlate the report with patient details. Repeat the culture when finding seen unusual. Let's see what comes under the mistake: not performing QC or not using the controls. It includes using the expired media, not using the positive or negative control while processing, and also not checking the lot to lot variations. How to avoid this mistake? Perform the QC daily, run the controls for biochemical test and antibiotic sensitivity test, and also never forget to document all the QC result properly. The final type of mistake we are discussing is incorrect reporting. It includes the typing errors, missing organism details, and also reporting the wrong antibiotics sensitivity interpretation. The precautions to be taken are: recheck the report before finalizing, follow the CLSI guidelines, and peer verification when needed. And that's it, dear friends. Mistakes are common, but in microbiology, correlating them is what protects every patient. When we work carefully, consciously, and with proper technique, our lab becomes a place of accuracy, safety, and trust. I hope today's video helped you reflect on your own lab practices and make small changes that bring big improvements. This is Sneha signing off for today. Stay curious, Stay careful, and I'll meet you in my next video only on Medical Guruji. Bye bye and take care.